Interleukin is the leading healthcare platform provider for facilitating simplified procurement and customer management solutions. Interleukin is also one of Kubo's top 100. Laila Marquez is the CEO and co-founder at Interleukin. So, hello Laila, I'm very happy. Finally, nakapagkita na tayo. So, welcome sa Startup Podcast.
Hello, good evening, Johnny. It's been my pleasure to have you here, to have me here in Startup Podcast. Sobrang excited ako to share Interleukin with you here and all your subscribers, the viewers here in Startup Podcast.
I'm also excited to know more about Interleukin. So, ano nga ba ang Interleukin?
Interleukin is actually a revolutionary B2B digital healthcare procurement that actually seamlessly connect medical suppliers and healthcare institutions. It provides quality fast, take note, it's not just only fast, but quality fast and simple procurement process for better healthcare delivery system. So it improves the business transactions between medical institutions and suppliers here in the Philippines. So we cater hospitals, clinics, laboratories, as a buyer institution, and even non-medical institution, we cover that. And to use our platform and connect them to different local and even international medical distributors in any region of the Philippines who want to expand their business, to connect more customers in a digital space through what we call eCommerce.
Yeah, okay, so I'm curious muna. So ano ba yung interleukin na term? Kasi I think it's a medical term. So if we could start with that. So share some medical terms with us.
Yeah, and so many people are always curious about our startup name, Interleukin. Actually, it's a medical science term because I'm a medical technologist by profession. I derived that Interleukin where maybe I can start explaining what interleukins function in the medical term, right? Medyo some kind of technical pero hindi layman to. I will make it a layman's term. So, interleukin is actually a type of protein that is produced by our cells. So, particularly yung white blood cells na tinatawag. So, its main function is to mediate different immune responses in our body. So it serves a mediator, that's interleukin, mediator between different cells of our body that has different languages for them to understand their need to do for the body. So ganun ko siya in-associate. I thought of this term since I love understanding about immunology. I thought of this term because my startup will be the mediator on the medical supply needs of different medical institutions to different suppliers in the healthcare industry as quickly as possible. This is interleukin in our body. Konting galaw lang ng isang cell or there is a kind of need, magre-react siya. So Ganon kasi ako as maybe I also associate with the personality I had working in the medical industry. Everything that there is urgency, we need to respond quickly. We need to mediate things that our patient needs or even our customer needs. So yun.
So in what I understand, so nagko-connect si interleukin ng different parts of the healthcare of the medical system. Naalala ko lang yung anime, I'm not sure if you're familiar, yung Cells at Work, if you're familiar sa.
Yes!
Yeah. Yung mga ina-animate nila yung mga red blood cells, mga white blood cells.
Yeah. It's a very good anime, guys.
Yeah, I watched it.
Para to understand better by a non-medical person how our body works, kumbaga.
And with that, so si Interleukin nga ay isang virtual medical marketplace. So what do we mean by this? Sino ba yung buyers? Sino ba yung suppliers? And what's the value that Interleukin provides for them? Maybe we can start with the buyers and then the suppliers.
Yeah. As I mentioned, the buyer, we're catering both kasi. So on the buyer side, we cater different medical institutions, which are either a clinic, a hospital itself, or a laboratory, freestanding laboratories, and even pharmacy outlets. They can use our system for them to find the right products that they want to use, or the right supplier that they want to deal with. So, yun yung on the buyer side. For the supplier side, of course, we are dealing with the, let's just say, the most legitimate medical suppliers in the country, because not everyone can sell, yes, but not all suppliers understand what they are selling, and at the same time, they should be able to know how to support these medical institutions. Kasi that became a problem actually during the pandemic. There were a lot of sellers that came in. Medical supplier sellers daw sila, but it happened that they cannot support actually their customers. So it ended up they still find the suppliers that they really want to deal with are the actual suppliers that are knowledgeable enough to support their needs, whether it's a pre-sale or post-sale activity pa yan.
Yeah, and I'm seeing in your tagline nga yung nasa background ng Zoom na to. So Interleukin is medical purchasing made simple. So if I understand correctly, so si Interleukin may website, e-commerce website na the suppliers can have their items there and then the buyers can browse there. Is that right? And how do you make it simple? I mean, ano ba yung parang features maybe na you have in Interleukin in the website? Yeah, so how does it happen really? And ano yung parang picture for the buyer?
Yeah. For the buyer side, dalawa kasi yung lagi nating kailangan consider. For the buyer side, it became a part of the simplicity wherein they can easily search the products that they need, the suppliers that they need. Parang there is a central hub of their medical supply needs na in the system. And not only that, not only for the searching, but also they can also do the negotiation, product evaluation, wherein they can request for samples of that specific product. Kasi on the healthcare, kasi we don't want to use it right away to our patient. So traditionally, we always as a buyer, we always ask for samples for us to evaluate the product first, if it's safe for the patient and if it's a quality kind of product that can be used for our patients. It's always the patients for the buyer side. And the most important thing is the payment and delivery. For the payment, kasi it's still on the offline. It's very traditional actually still on the healthcare. Wherein Interleukin will be handling those payments digitally. So, and delivery itself, we want to help our medical suppliers to assist them on the delivery needs to be as urgent as possible, because healthcare institutions always ask for urgency. Walang chill lang. There's no chill moment.
Mabuhay ng mga tao na nakasalalay. So ano ba yung mga items na to? I mean, just to have some examples. Ano ba yung mga items na nabebenta at nabibili sa Interleukin? Ano ba yung mga natatransact? And then, like, sino ba exactly yung mga possible buyers? So can you just give mo mas concrete maybe na example for our listeners? So, yeah.
Yeah, for the products that they will see, most likely we cater the highly consumable products, which are blood collection tubes, yung mga pangkuha ng dugo, okay, which we always being done in every day sa patients, right? The needles, syringes, of course, PPE, that's very popular, na naging matunog during the pandemic, but it's always been a part of in the healthcare, in the hospital, in the lab, gloves, those things. And right now, the hottest thing because of the surge is the antigen kit. So, wherein I kind of realized that it's really a good help for them to please find the right product that they need for our customers.
And so yung mga buyers no is like yung mga clinics, yung mga testing centers, etc. And I just thought lang, maybe yung mga suppliers, kaya din siguro nga nako-confuse. Like, kasi yung ibang items, like yung syringes, yung needles, I mean, it's not necessarily medical. I mean, pwede siyang gamitin for other uses. So, I mean, maybe sa Interleukin, parang talagang dinadala niya yung suppliers into the health sector, into the medical sector. Is that right?
Yes.
Okay. And I also saw, I think it's interesting yung pinagmula ni Interleukin. So, I saw this in the website. So, nagsimula yung idea and yung concept ni Interleukin noong Taal, volcanic eruption, last January 2020. Actually, medyo nagkaubusan nga nun. And doon nag-start yung bumibili yung mga tao ng face mask, ng mask. So, can you share more about the story? Ano ba yung talagang problem na nagpanganak kay Interleukin?
I was still in the working in the corporate that time, and I'm one of the parang naapektuhan din ng volcanic eruption of Taal that time because I live in the south. So that happened is I saw a lot of needs niya ng medical mask. So sabi ko, but then I also saw my customers in the lab, in the hospital, they're running out of stocks. Kasi ordinary people hoard or talagang kinuha talaga nila yung parang gamit ng mga healthcare workers. Diba? Parang somehow parang rin ako, like wherein as a supplier at that time, I know the feeling of yung stocks mo is allocated for the healthcare, but you have to cater the general public. So the forecast nagulo na yung forecast ng yung supply chain nasira na agad.
Naubusan yung mga health center, yung medical. Okay.
Yeah, and then it happened na marami ding nag-abuse na suppliers na the price went up. Yeah. So parang which is not fair. Siyempre, diba? It also affect the health the medical institutions kasi it went up just because of the unpredictable demand.
Yeah.
Diba? So unforeseen demand. Kaya from manufacturer itself, they kind of abuse it, that demand. So sabi ko there should be a way how these things should be managed. Kasi you need to manage the abusers and the hoarders, kumbaga. So and then my customers that time are having the difficulty to find the right supplier for this medical mask or N95, pati N95 should be used in the hospital lang. Pero ordinary people are using it just because dahil they understand that it will protect them from inhaling those tiny particles of the volcanic diba? So yun yung wake up call for me. And then I started to help out my customers actually to find a supplier for them, even though it's not my actual product that time. So it's part of my extended service to my customers. That's why they love me. Actually, I don't abuse them or take advantage of them. It's just that I just want to help them find whatever they need. Kasi I'm also a healthcare worker eh.
Yeah.
So I don't want to suffer.
Dapat lang no na we really provide for these healthcare workers kasi I mean kailangan and napakalaking service yung pina-provide niya sa mga tao basically. Tao din naman yung mahihirapan kung walang nagagamit na items na supplies yung mga nasa medical sector. Yung ano ba, yung face masks na yan, binebenta ba siya like sa mga convenience store? I mean yun ba, doon ba bumibili yung general public? Ano ba nakakabili? Ano ba nangyari nun?
Before, there was no face mask that is sold in the convenience store. Actually, you can just find it in the medical supply stores.
Yeah.
Bambang, if you're familiar with Bambang, you will see that the legitimate medical supplies who are importers of those products. Pero it became na you can see it everywhere, even in the side street lang right now. So instead I didn't anticipate that before until pandemic hit. Parang nagtuloy-tuloy na siya. So the problem, the disruption on the supply chain because of the Taal volcanic eruption, naging na siya, nagpatong siya when we had a lockdown. Kumbaga, hindi pa naayos and then andyan na ulit.
Magkasunod nga mismo yung Taal eruption tapos yung COVID. And yeah, speaking of COVID, so like ngayon, ano na nga ba yung anong state ngayon ng supply chain? Sobrang gulo ba or naayos na ba somehow? And paano mismo like na kukuha ng buyers, ng customers ni Interleukin yung value if like now na sobrang disrupted yung supply chain ng medical supplies. So ano na ba yung nangyayari ngayon?
Yeah, actually still it's still not yet normal it's like before. Still everything is disrupted. Not only the Philippines, globally. So the global supply chain in the medical industry is really disturbed. It's a chaos with the up and down of the cases of COVID. So what we can do is actually to manage things to help teach the buyers how to forecast their needs, advise them to start planning their needs so that the supplier and will also be able to plan their supplies, their stocks. Kasi it will take a long time ngayon to arrive those stocks. Kasi nga daming there are a lot of lockdowns, quarantines, those things. So less of manpower and then mag-umpisa sa pinaka-ugat. Even the raw materials, the creators of raw materials, disturb din yung production nila. So, kaya, naging domino effect. And so, so may app din na nagagamit nga yung mga buyers to procure this supply. So, and by the way, congrats sa beta app launch last year. And then I saw sa website and then sa app na meron kayong parang 3 principles, I think, na provide yung procurement management, superior customer service, and transparent transaction support. And I think yun nga, you also help basically in the general supply chain planning. So can you just share about this app, this digital platform, and just share basically how you do e-commerce for the medical sector. Yeah, the value of this Interleukin sums up with the 3 actually. With in terms of procurement management, it covers faster negotiation, transactions. It's efficiency, all about efficiency. So we cover all from end to end, from searching to payment. So that's what on the procurement management that we are the value that we are giving. On the customer support, as I mentioned, we just don't sell, but we teach our buyers. What you can see on the in our app when they search the product, it's not just only the product, the specs itself. What is it? We tend to put in the specs that the user wants to see. Hindi lang basta picture. And also, if they have questions, we can explain the product itself for our buyers. Say that's one of the things that they really appreciate. There should be always a personal touch in the healthcare. Hindi mo talaga maaalis, especially if you're a Filipino. Our culture, there should always be a personal touch. There's always the thing that I keep in myself when I build Interleukin. I should not be able to remove the personal touch of dealing with the customers. So, and then transparency. So, this is the biggest challenge in the healthcare industry. There's no data. So, with Interleukin, as different institutions will be using this, we will be able to provide that big data for them, because there's no data for the healthcare. Kaya nga, the supply chain is magulo. Ilan ba talaga yung mask na kailangan? Para saan ba talaga? Anong disease lang ang kailangan ng specific na product na to? Those things, those data, eventually we will be able to provide that if everyone are jump into this kind of space, right? There will be better forecast accuracy, the pricing will be managed, consumption needs will be able to manage. And of course, with that, savings, di ba? Both, either you're a supplier or you're a buyer, you'll be able to have better savings.
Yeah. Ang interesting actually, kasi like ngayon nga, ang daming mga startups na digital marketplace, na e-commerce, na kanya-kanyang industry, kanya-kanyang field. Meron sa itong field na to, sa itong field na to. Interleukin is medical sector.
Yes, it's a focused medical industry, medical procurement, e-commerce.
Yeah, and I like yung personal touch. I agree na it's really important to have that feature. And Interleukin was also part of Kubo's Top 100 nga, and may inorganize kayo na session nung Philippine Startup Week 2021, and ang title niya is Improving Healthcare Through eCommerce. So maybe can you just share ano ba yung nangyari nitong session na to, and maybe some takeaways or insights na so maybe can you share about this?
Yeah, actually it's a big break for Interleukin since we launched our app last year. It's also a kind of a big launch for us to be part of the Philippine Startup Week and have that event. Actually, the intention of that event is actually to let the medical industry, the healthcare industry, to open up their minds that we should be able to start jumping into digital space. Not just only on the telehealth, but also touch on the procurement, because that's where the operations in the medical will be able to function, di ba? It's very important kasi ang procurement or the supply chain itself. So, pag walang gamit, then walang magagamit sa pasyente. Diba? All of us will become a patient. So, that's why I invited different people in that event, working as in the medical industry, whether they are a supplier, a manufacturer, person in the hospital, doing startup, in the medical industry too, a healthcare worker. So different areas in the healthcare industry, wherein they give their insights on how we can help each other, how we can collaborate, what are the things that they need for them to improve our industry. Because as I kind of remember one of the speaker there, the panelists there, mentioned that healthcare industry is the slowest to adapt in terms of technology. Yeah, this he really admit that, and he's one of the people in one of the biggest hospital here in the Philippines. So he really admit that. That's the kind of, because because in the healthcare we tend to be very reluctant on the process that we already have for decades. So and we have a lot of excuses because we are always busy, we are always catering patients. That's why we don't want to adapt things, and we are very impatient on technology. So that's the challenge actually for the healthcare. So that event is kind of an open door for them.
Of course. I think it's good na parang even yung problems and yung challenges is na-admit kasi that's how we can solve them, di ba? And I really like na parang kinonnect nyo nga talaga in that event kasi yun din talaga yung role ni Interleukin. Kinoconnect yung different parts ng medical sector, ng healthcare sector. Parang yung different characters nga sa sales at work. Kinoconnect niya yung mga pinagsasama-sama nila sila, pinag-uusap. I mean, kinoconnect basically to have one aggregated and efficient sector. And
even the public sector, I invited one person in the public sector, which is our moderator as well. So, because they also have that biggest challenge in the procurement in their needs.
Yes. So ano ba yung vision ng Interleukin talaga into the future? Maybe ano ba yung nakikita nyo na ideal state maybe ng medical sector in the future? So, can you share?
Actually, the vision of Interleukin is not just only the Philippines, but to be the Asia's gold standard of B2B platform for healthcare procurement needs by providing the most advanced digital solutions for purchasers, consumers, and partner distributors, and even manufacturers, whether they are local or international. We want that, that's our vision, wherein we will be able to provide that data, that big data we need, so that we will be able to have a synergistically work together, whether you're a public or private sector. We have that data so that we can be able to improve our delivery system, healthcare delivery system.
So, healthcare delivery. And I think napakarami niyan. Public, napakaraming players niyan. Private, napakaraming players niyan. So, I think it's a very complex problem nga that you're trying to solve it. Yeah, so, yeah, I'm really looking forward sa growth pa and sa problem na to that Interleukin is really trying to solve. So, yeah, thank you very much, Laila. So, maybe if listeners want to know more about Interleukin, maybe some listeners are in the medical sector and they want to maybe use the app or they want maybe to partner with Interleukin. So, how can they find more information? How can they know more about you?
Yeah. If you want to know more about Interleukin, of course, visit there www.interleukin.co, or you can email us directly at info@interleukin.co, or you can add me in LinkedIn, Laila Marquez, so that we can talk more about how we can help you grow your business as a supplier in a digital space or as a buyer, wherein you'll be able to find and search the products that you will need for us to. We will assist you, whatever you need. We will connect you to the supplier that we can give you the best possible supplier for you.
Yeah, I really support Interleukin and I really support you dito sa napakahirap na problem that you are trying to solve. So yeah, good luck, Laila, and yeah, more power moving forward. So thank you very much for coming dito sa Startup Podcast. We're very honored to have you here.
Thank you so much, Johnny, and more power for Startup Podcast.
Thank you.
Thank you very much to our 7 patrons. This episode is super powered by NutriCoach, the all-in-one productivity tool for dietitians and nutritionists. This episode is powered by ePlayment. Support us at www.patreon.com/startuppodcastph.